When it comes to infant mortality, Ohio is making progress. That's great, but not when it comes to African-American babies. In fact, get this, folks, 3 out of every 4 babies that die in our state, Ohio, are African-American. It was a focus of the Ohio Infant Mortality Summit held in downtown Cincinnati today. Joining me is County Commissioner Todd Portune. He's also, well, he's president of the Hamilton County Board of Commissioners. He's also co-founder of Cradle Cincinnati, and you were at that summit today. Thanks so much for popping in today. Appreciate
Thanks for having me out here today to talk about this.
What is at the heart of this? 3 out of 4 babies that die in Ohio are African-American. Why?
Well, that's the focus of the summit, and one of the reasons why we have the summit here in Cincinnati. I made this pitch 2 years ago in Cleveland when I spoke up there at the Summit on Infant Mortality Reduction. What we found at Cradle Cincinnati, that it really comes down to the social determinants of public health, of infant and maternal health. Infant mortality is not a disease. You can't cure it with a pill or a shot or anything like that. It's the cumulative effect of a variety of conditions that boil down to lack of access to health care, or affordable health care, or just the way in which doctors communicate with individuals. And you really have to have your messengers around infant and maternal health be individuals that are trusted in the community. And quite often there are breakdowns between people who are in a public health setting or a private health setting, hospitals, doctors, and the like, and the very individuals whose care they need to provide for and who need that care from pre-pregnancy forward.
There's a lack of trust between like the pregnant moms and nursing and doctors and that kind of thing?
There is, you don't have the same level of trust about the things that you need to do. So let me give you a good example. Safe sleep is one of the areas that we agonize over infant death.
Sure,
and
we've SIDS and such.
Correct. Well, we've been able to reduce death of infants before their first birthday here in Cincinnati through Cradle's efforts by 25% in the last 5 years. And, but you have to get at issues of what it takes for a baby to sleep safely in a crib. It's the ABCs of safe sleep, alone, on your back, and in a crib. Well, people for years and years and years were told by parents and grandparents a baby goes to sleep on their stomach. Right. All right? Doctors are saying to do one thing, and parents and grandparents are saying another thing. So you got to break down those barriers that exist.
Now. Okay, with just a few seconds left, tell me. You said there is progress being made in Hamilton County.
There sure is.
Is there hope? We're doing better, right?
We are doing much better in Hamilton County. In fact, the rate for deaths of African-American babies, while it's still, the overall numbers are still far greater than majority babies, Caucasian babies, all of our rates are coming down, both for African-American babies as well as Caucasian babies in Hamilton County. And again, that's one of the reasons why Cradle has been so involved in this effort statewide to help the state of Ohio and others try to reduce this scandal in our community and statewide of why so many babies are dying before their first birthday.
Hamilton County Commissioner President Todd Portune, thanks for coming in.
Thanks, Tanya.
Glad to see you up and about.
It's good to be up and to be seen. Thanks.
All right.